My name is Florian Groß. I'm 44 years old, and I opened my dental practice here in Dreieich 15 years ago. I studied dentistry in Frankfurt, graduated in 1998, and opened my practice right after finishing my residency. In my practice, we offer all areas of dentistry. Of course, the equipment in the practice has to be functional and meet the technical requirements 100%. But this doesn't mean that we have to buy every new device that comes onto the market to keep up to date in this field. Decisions on what to buy require a lot of thought. Patients' needs have changed a lot in recent years. Today, hardly anyone would accept the so-called gold standard, meaning metallic dental restorations in the visible areas of the mouth, as the best treatment option. In my opinion, there is no longer any reason to use gold alloys as the framework material for permanent dental prostheses, especially since they have become so expensive with the high price of gold. It used to be the other way around. Then, a zirconia restoration or framework was much more expensive than a gold framework. But the higher price of gold and the much higher number of zirconia restorations requested in labs have evened this out, so that today you can certainly offer a zirconia restoration at a lower price than a veneered gold alloy. The decision on which material to use for restorations should be made jointly by the dentist and the patient. I offer patients restorations depending on the available options, and the patient then has to make a choice. Of course, there are limitations for some restorations that the dentist must be aware of, and patients have to be given recommendations accordingly. For restorations in posterior teeth, the stability and durability of the restoration are especially important. I like to suggest monolithic zirconia restorations for the posterior teeth, because stress there is very high, and only metal or zirconium oxide ceramic can stand up to it over time. The veneered zirconia restorations are less stable because a certain number of restorations will develop cracks in the ceramic veneer over time. And full zirconia restorations have a failure rate of 0. At least, I've never experienced any kind of failure. They do have some optical disadvantages, but these are not relevant in the posterior teeth. All zirconia restorations, not only monolithic zirconia restorations, can of course be cemented conventionally with adhesive cement, which saves a great deal of time compared with pressed and layered ceramics. There is no need to handle hydrofluoric acid, no need for silanization. You can simply cement the zirconia restoration onto the stump with any cement. I have also not yet found any abrasion of the antagonist from full zirconia restorations. In my opinion, this is a question of careful work. If restorations fit properly, there will be no abrasion of the antagonists. Abrasion would be due to a dentist's error. Of course, it would be an advantage if a tooth could be restored and the patient could return home within a period of 1 to 1.5 hours. I don't think that's feasible. The moment when the restoration is finished and can remain in the mouth. When the session is finished, you've looked at your work and can give the patient a mirror so he can see for himself. That is the moment when you can enjoy the fruits of your labor. And that gives you a feeling of success and satisfaction.